Good afternoon. This is Dr. Padgett, and this is the recorded lecture for the Urban Geography class for May semester, summer 2020. Let's just get right into it. Today's lecture is going to cover urban food deserts, and so I'm going to share the screen here for you all. And so here is the list of research materials on delineating urban food deserts. I'm going to be presenting the first two PowerPoint presentations here. Also is a study that I did with Dr. Heather O'Hara at Meharry Medical College on the link between urban food deserts and obesity. Then there are 4 videos that you might find interesting. Food Deserts of Memphis, this HBCU Wellness Project on food deserts is also this Weight of the Nation documentary partially filmed in Nashville. And then there are just a number of readings and articles, some written by me on urban food deserts for you to peruse as you write your reflection paper. And so speaking of which, the reflection paper assignment requires you to, let me go here. So this would be the Urban Food Deserts reflection paper assignment. And so you are to view this video and then peruse the articles that I just showed you as references, and then just write a 500 or more word reflection paper, meaning that it doesn't have to be entirely research focused, but I do want you to reference the materials as it's warranted. So you look at the cross sections between food deserts and urban inequalities, look at pertinent data, variables, and indicators for GIS-based food desert delineation, assessment, and research. And then finally, what are some potential strategies for mitigating food deserts that you've seen that you think are possible to sufficiently lessen the negative externalities associated with food deserts. So I'm going to jump right into the first presentation. And so this presentation is entitled Food Deserts Mapping Project 2003 to 2013. So amongst my claims to fame is the fact that I was the first person to map Nashville's food deserts. And I'm going to take you through that process. It was a 10-year period that started around 2003. And this presentation covers from 2003 to 2013. Then I have a second presentation that's going to have a little bit of overlap with this one, but it's going to take a much more educational perspective on food deserts. So first, let me just go step by step through my food desert mapping methodology. There are others, and I will show you some other methods to map food deserts. I'm not the only one that has a methodology. Of course, I was the first to map Nashville's food deserts, but I'm sure that in other cities, there are others doing this work. There are many people doing this work in Milwaukee and Atlanta and Memphis and in New York and Philadelphia and all over the country, literally. So going back to 2003, I was approached by an organization called Tying Nashville Together, and they were doing a grocery store quality analysis project or outreach project. They were going into grocery stores to determine whether those stores were equally serving people in Nashville from neighborhood to neighborhood. And the suspicion was that there were certain stores that were overpricing people, perhaps in lower income neighborhoods. Certain stores didn't have the same quality of goods and services, and so on and so forth. And then some stores were just not healthy. And so they actually got the database of food stores from the Metro Health Department. So if you've ever gone to a restaurant or a supermarket, all of them have a score from the health department that ensures the customer that this store is reasonably safe and clean. And if not, then they can be sanctioned, fined, or in some cases, shut down completely. So I was approached by Tying Nashville Together, which was a coalition of faith-based organizations, and they wanted me to map the results of their grocery store quality analysis exercise, and I did. But in doing so, I saw that there were certain communities that didn't even have grocery stores. And when I say grocery stores, I mean a full service store like a Kroger or a Walmart superstore or Food Lion or Winn-Dixie or Giant Food, someplace like that. Not necessarily one of these little corner markets that may or may not have fresh fruits and vegetables, fresh fish. They might have a organic food section, perhaps. You know, that's what we call a full service grocery store, maybe even a pharmacy. But a lot of communities, if they have a grocery store, it might sell more fried chicken and beer than groceries in a lot of communities. So when we say grocery store, we're not referring to a convenience market or a corner store in some cases. And there are a few exceptions when you have a private, independent owned grocery store in a neighborhood that does provide healthy products for its customers, but that is sometimes very rare. But I did find that there were communities in Nashville near Casey Homes, John Henry Hale Homes, Edgehill Homes that had very low access to healthy food. Anyway, so this map was produced by a student in my cartography class in 2003. And as you can see, there are grocery stores, and then there are Black neighborhoods. And where you see Black neighborhoods, you don't see grocery stores. And where you see grocery stores, you don't see Black neighborhoods. And so this was just the first map that eventually resulted in me developing a methodology where I used the centroids of these low-income communities, and I drew a 1 mile radius around those community centroids, and also look within those centroids. Look within those communities for an elevated number of homes that did not have an automobile. And so those three things together, distance from grocery store, relatively low income, and lack of private vehicle ownership, those are the three major variables that led to my defining places as food deserts. So for example, here is the Edgehill Food Desert. So this is now getting to 2004. And so this is the Edgehill Food Desert. And you can see there's that 1 mile radius. And you can clearly see these point symbols representing renters and homeowners who do not have automobiles. And you can clearly see this pattern of increased numbers of houses that do not have automobiles, and no grocery store. I guess at that time, the closest grocery store on a 1 mile straight line distance was the Harris Teeter on 21st Avenue South. That is now, of course, a Kroger. But not any stores anywhere, certainly not within walking distance. Very difficult to get to via public transit also, which is a whole other issue. So this is one of my first food desert maps in 2004. And then here is another map showing the KC Homes area and the Napier Homes area, which I call captive grocery store clientele. So in these neighborhoods, they were served, and served is probably being generous, served by grocery stores that perform very poorly on Metro Health's uh, health score scale. For example, some of these stores were found by the Tying Nashville Together group to have food on the shelves 4, 5, and 6 years past expiration date, not months. 4, 5, and 6 years past the expiration date on the shelves of these stores. And you might ask, well, how could these stores stay in business if they are so unhealthy and have poor service? Well, notice that the communities that these grocery stores serve are largely people who don't have cars. They have no place else to go. They have no choice but to go to these poorly performing stores. And so these are what I call captive grocery store clientele. They are beholden to the whims of these poor examples of business people in the community. Both of these grocery stores are closed now. That was 2004. The grocery stores near Casey Homes, that Casey Homes and Edgefield Manor, that one closed and it was replaced by a not a Dollar General, a Family Dollar store that doesn't sell any food at all. So note that was 16 years ago, almost 16 years ago, and still those communities don't have a quality store anywhere near them after 16 years. So now moving forward to 2009, I was partnered with the Food Security Partners, and they wanted me to look at whether or not there was a correlation between fast food establishments. As we know, fast food is not good food, it's not healthy food, and in some cases it's questionable if it's food at all. And I also collaborated with Dr. Heather O'Hara with some data from Dr. David Schlunt at Vanderbilt, and we looked at the relationship between obesity and food deserts. So now we're looking at the overall health impacts these food deserts have upon populations. Now, the research does show that people who live in food deserts are more likely to eat fast food. It's cheap, it's convenient, not healthy, but it's food that people can afford. And oftentimes they often fall prey to these fast food restaurants. So here, this is the Edge Hill Food Desert once again. This is an updated map, 2009. And you can see these red point symbols represent fast food operations, and there are plenty of them in very easy and close distance to this community. And that's pretty common for food deserts. There's another term called food swamps. It's when a community is not only a food desert, but it has lots of these fast food restaurants, maybe lots of corner stores that sell fried chicken and all kinds of unhealthy foods, and people consume those foods a lot. As a matter of fact, some of the convenience markets that might also be gas stations actually make more money off of fried chicken than they do gasoline. In fact, in some cases, over 90% of the profit comes from fried chicken in some of these convenience market establishments. All things in moderation, but if you're eating fried chicken every day of the week, that can become problematic. Here are the 4 original Nashville food deserts, and this is a zoomed out view, and you can clearly see that the North Nashville food desert here is just littered with uh, fast food restaurants, and then of course here's Edge Hill, and to some degree the JC Napier Homes food desert, and then the KC food desert has a few fast food establishments up along Gallatin Pike, which might be within reach of the community, but not many restaurants or any services at all in general around that community. So they don't even have fast food in that part of East Nashville, at least at that time, 2009, about 11 years ago. So moving forward, uh, again, my collaboration with Dr. Heather O'Hara, we looked at body mass index and food desert. So here's the Edge Hill Homes food desert. These numbers, 25.76, 26.3. So if you have a BMI body mass index of over 25, that is an indication that you are overweight. If your BMI is over 30, then that is obesity by definition. And as you can see, there's not that great of a difference in terms of BMI inside versus outside of these food deserts. And that is because at the time that this map was created, approximately 2009, 2010, Tennessee was the second fattest state in the United States, had the second highest rate of overweight and obese people among any state in the United States. And so whether you lived in a food desert or outside of a food desert in Tennessee at that time, people had weight problems. And that just was the case across the entire state at that time. I think Tennessee's doing a little bit better now that there's been some awareness, and we've got a little better. I don't think we're number one. We might have slipped down the number. I know we're in the top 20, but no longer number one. So here are just some of the things that happened over the years. So in 2003, when the first food deserts were created, that brought a lot of attention to community partners and community stakeholders who got involved in trying to mitigate this issue. So this kind of started a movement. By 2009, 2010, like I said, Meharry Medical College got involved. We started to look more closely at health impacts. And then we got to 2010 and 2011, we provided data to the Metro Health Department that received a $7.5 million grant called Putting Prevention to Work. So we were part of that Putting Prevention to Work project that funded the corner stores project. So I mentioned those corner stores earlier. So at that time, the theory was that people in food deserts are eating at these corner store markets, and that's where they were shopping for food. And so when the corner store market owners were approached as to why they did not provide healthy food to their customers, the corner store owners said, well, we would, but we don't have the equipment. We have to keep these foods cold. We don't have refrigerators, et cetera, et cetera. So the corner store project paid for equipment for these business owners so that they could essentially sell fresh fruits and vegetables and keep them adequately refrigerated or frozen or what have you. And so this map that you see here is essentially a map that we use to select the corner stores that were to participate in the program. And so the green point symbols are corner stores that are inside of the Edge Hill food desert in this case. Then we took a quarter-mile distance outside of the Edge Hill community. So presumably people that live in this community could walk to any of these establishments. And as you can see, there are a lot of them. And so the belief was that if we provide these corner stores with fresh fruits and vegetables and other foods, that would somehow mitigate the food desert problem. The problem is that this study and others throughout the country found that people who live in these communities don't necessarily want to buy their groceries from a corner market. Think about it. Would you buy an apple from Exxon Tiger Market? I wouldn't. And most people don't. So research showed further that a lot of people in these communities want to shop the same places that everybody shops: Walmart, Supercenter, Kroger, Publix, and what have you. And so it's not to say that this project was a failure. It was a learning experience. People learned that this being putting all the fruits and vegetables you want to in some of these corner stores, that's not going to bring people there to buy their groceries. Just, you don't associate some of these convenience markets with groceries. You associate them with 6-packs of beer, fried chicken, but not groceries. So there's some good news. The food movement conversation that occurred over the years resulted in the reestablishment of the Save-A-Lot food store chain in Nashville. Save-A-Lot stores target households that have incomes of approximately $40,000 per year or less. So just to put that in context, the average household income for the state of Tennessee is about $60,000 per year. So we're looking at households that have about 2/3 of the average household income for populations in Tennessee, moderate to low income communities. I mean, that's the audience, that's the customer base for Save-A-Lot stores. Now, prior to this movement, Save-A-Lot really had a bad reputation throughout Nashville. They were some of those stores that had low health scores, poor service, and so on and so forth. But the conversation in Nashville got the attention of the Save-A-Lot corporate office. And when they came and saw how bad Save-A-Lot stores were in Nashville, they closed every last one of them. The Save-A-Lot stores in Nashville at that time were franchises. And so franchise operators have some amount of autonomy in terms of how they operate. And I guess a lot of franchises, they have certain corporate, certain corporate traditions and ways of doing business and so on and so forth. But each franchisee is allowed a little leverage or a little levity, but in this case, these franchise owners took things a bit too far in terms of underserving populations that were already underserved and obviously disenfranchised. So all those Save-A-Lot stores got shut down and they were replaced with corporate Save-A-Lot stores. And I used to live down the street from the one that's in this picture. I used to live right down the street from the Save-A-Lot on Clarksville Pike. And when it first opened, I was skeptical. I thought, yeah, they're going to do well. They're going to keep it clean for about 5 or 6 months. And then they're going to get comfortable. And the next thing you know, it's going to smell bad. It's going to be poorly stocked. It's going to be a mess. But that didn't happen. Because they had direct corporate oversight, this store, now it's not perfect. Save-A-Lot is what it is. There's a whole lot more processed foods in Save-A-Lots than I would like to see, but they do have fresh fruits and vegetables. They do have a lot of the same products. They have fresh meats, fresh fish, a lot of the same products that you might see in Kroger. At least it's there. And from what I remember, it's well, they have a good customer base. It's a solid customer base from what I remember. It's not going to close down anytime soon. So this was a win, the reestablishment of the Save-A-Lot stores in Nashville. So in 2013, so now we've gone to 2003 to 2013, The Civic Design Center. So if you remember earlier in the semester or earlier in the Maymester, we participated in that Civic Design Center collaborative conversation. That same Civic Design Center approached me and asked me to look at the potential for suburban food deserts. And at first, I didn't think that there would be any, but then I remembered uh, during this time, and especially when we got into the recession of 2008, 2009, a lot of poverty shifted to the suburbs. And so I did have some suspicion. I applied my same methodology for food desert delineation. And I was primarily, if you look at this map, primarily looking at these areas here in Madison and in Antioch, in Bellevue, north parts of Bordeaux, perhaps, this Bellshire community here. Now, when we talk about suburbs in Nashville, we have to be careful. Nashville, Davidson County is a combined city-county government. Uh, Nashville was one of the first cities to combine its city and county government in 1963. Almost every other large city that's combined their city and county government has used Nashville as the model. Jacksonville, Florida, Louisville, Kentucky, those that came behind Nashville used us as a model, or Nashville as a model. And so you see this dark area, light blue area, that's known as the general services portion of Nashville. That's what used to be the city of Nashville before it combined with Davidson County. So we have a relatively large area. So when we say suburbs, we don't necessarily mean places outside of Davidson County. What we really mean are places outside of the general services district for Nashville, and that includes Madison, Antioch, and some of these other places that I mentioned a few moments ago. And so looking at Antioch, I found a potential food desert. It's at the intersection of Antioch Boulevard and Interstate 24 and Nolensville Pike. Right in that intersection, you can see high numbers of people without automobiles, about at least a mile away from the grocery stores on Nolensville Pike, and underserved in terms of public transit. So, here's a potential food desert in Antioch, and here's another one in Madison, which is north of town. This one kind of surprised me because I used to live in Madison. I did not notice that there was a lot of poverty out there, but I did notice that there are a lot of trailer parks out there, some large multifamily housing communities that appear to be catering to lower income populations. And so here's what is a burgeoning food desert out in the Madison community. So so this work continues. Obviously, the food landscape changes all the time. We now have 3 supermarkets in downtown Nashville just in the past few months. I think there's a Whole Foods, there's a Publix downtown. There's the turnip truck that's downtown, and the Gulch has been there for a little while, maybe at least 5 years. But that wasn't there. That's only a recent arrival also. So the food landscape has changed. It will be interesting to see what kind of mitigative effects, if any, those food stores in downtown Nashville have upon urban food security in Nashville. It would be very interesting to look at that. There were 2 neighborhood Walmarts on Gallatin Road that are no longer there. That's an interesting story that we might get into when we get into our discussion next Wednesday. So here are just some efforts to mitigate food deserts. A few years ago, the state of Tennessee created a $10 million, basically a food desert mitigation fund. Unfortunately, it never made it out of the legislature. Tennessee is a red state. Red states tend not to support efforts like this. So unfortunately, that didn't go through. But it was an idea. At least there's the groundwork or the possibility, or at least the hope, that state governments can get involved in this kind of investment in communities so that they could subsidize food stores. You might not be aware, but the food business is a very narrow margin business in terms of profit, very narrow profit margin. You would think that people selling food would be making all kinds of money at Kroger and Publix, but it's a very narrow profit margin business. And so in some cases, food retailers have to be incentivized either through funding or tax breaks or something else to place one of their stores in a low-income community. And so the idea is there. It's a strategy. We didn't even get a chance to see if it would work in Tennessee because the funds were never dispersed. But it's an idea. Here's Kroger. There are tax breaks, and so Kroger got a few years ago got a $20 million tax break to put stores in food deserts. And I've seen some of these projects around the country, in Washington, D.C., and in Atlanta. Atlanta went back and forth. There was a Kroger on Ponce de Leon that closed down and then reopened, perhaps as a result of these types of incentives, or who knows. Now, the Nashville mobile market was an attempt to serve communities by bringing food to the people on these mobile market trucks. The business failed after a few years, largely because of the narrow profit margin. It was very difficult for this business to be sustainable. Great idea, excellent idea. If people can't come make it to the food markets, let's bring the market to them. Great idea, but great ideas don't always work. The reality is a lot more financial support is required to keep something like this afloat that has a very narrow profit margin. Interesting idea, though. And here are just some examples of research. This is a retail food index. Again, and there are plenty of these out there that look at or take a quantitative approach or a scientific approach to defining what a food desert is or what urban food insecurity is, so we could perhaps more quickly and easily identify these places that have need. And so here's another study, using GPS to determine whether shoppers change their behavior in places where food stores are placed. And so it's not just about putting a grocery store in a neighborhood. It's definitely about putting a grocery store there and then having people make healthy food choices after they get a grocery store. What you don't want to do is have a grocery store there and have people going in there to get even more fried chicken, even more processed foods, even more potato chips, and all the other things that are making them obese and shortening their lives. What's the point of putting a grocery store in a neighborhood just to make it easier for people to have unhealthy diets, right? And so there's an educational process involved here. Hopefully you watched the video about the Philadelphia food desert. Watch that video. It's only 7 minutes, but it's powerful in that it just really speaks to the issue of this not only being a geographical problem, but it's also an educational problem. It's hard to get people to change the way they eat. There's a really good film. It's on YouTube. Maybe I was going to put it up, but it's called Soul Food Junkies. It's called Soul Food Junkies. And it's all about the emotional connection that Black people have with certain types of food. It's not just food. It's your mama, it's your grandmama, it's your auntie that made these foods that you grew up on that were fatty and greasy, but there's an emotional connection. It's hard to give it up, right? And so that's just another thing that we might want to look at in terms of being educational process. Um, Here's an article by one of my friends and colleagues, Dr. Paul Robinson, and they took a quantitative approach looking at whether distance from a supermarket improves people's food intake. And their study their preliminary findings showed that yes, the closer people live to a supermarket, the better their diets happen to be. And that was a study that was done in Los Angeles. You might want to. This was in 2013. I'm pretty sure if you Google that title, you'll find it. I might add it to the reading list, after today. I'm from Baltimore. Baltimore is notorious for food deserts. There was a period of time when there were no major grocery store chains in the whole city. Every last one of them left Baltimore City, and so there has been a fervent effort on the part of the city and nonprofit organizations to get healthy food back into Baltimore. And so there's that. And here's the report on how farmers markets can be used as a mitigation factor for food deserts, because again, farmers markets are more flexible and they actually bring locally grown food to communities. They're mobile. They can be set up anywhere at a church. They can be set up at a community center. So this is another mitigation strategy. New York has its Green Carts program. That is another strategy where individuals can be licensed to sell fresh fruits and vegetables in any neighborhood on these green carts through subsidies. Urban gardens. This was in St. Petersburg, Florida. Years ago, I was invited to St. Petersburg, Florida, to look at or be a consultant on their food desert problems. And so I was taken on a tour of how this community responded to this grocery store being closed down by establishing urban gardens. So they were growing their own foods. And in Florida, they can grow all year. They can grow year round. And they have the climate where they can grow year round. They don't have the limits that we do here, perhaps. This is the Tampa, St. Petersburg hunger map. And so this is just a map that shows where all food sources may be, including those places that are pantries and food kitchens and places that take SNAP and other public assistance funds. And this is a really useful map for people that are just trying to get food from just about anywhere. So this is what I mean by the food landscape. It's not just grocery stores. It's these soup kitchens and homeless shelters and bodegas. A lot of bodegas don't even show up on some of the health department databases with the Krogers and the Publix, even though the bodegas have everything that you can find in Kroger or everything that you can find in Publix and even more stuff, especially if you happen to be a person not born in the United States. There are certain foods that you might eat if you're a Muslim, or if you're Latino, or if you are Sudanese or Ethiopian or what have you. There are certain foods that they eat that like goat meat. Try to find goat meat in Publix. Probably can't find it. Lamb meat. Try to find lamb meat in Kroger. Probably can't find it. But you can find those products in the bodega. Uh, Here's the USDA food desert mapping tool. This is another tool that is used to delineate food deserts. But just my personal opinion, food desert mapping should be done on a local scale. This 30,000 foot look at food deserts sometimes misses a lot of things that we really can't see from the federal level. Just my opinion. It's still a decent approach. It's a nice tool if you want to use it to explore. Here is the healthyfoodaccess.org. So this is a nonprofit organization that provides education for both food consumers and food vendors. How do we, a lot of food vendors might have every might want to expand into low income communities. They might really have the desire to expand in the low income communities, but having a desire doesn't necessarily mean that you know how to do something. And there are many cases of where grocery store owners have placed foods in food deserts, and within a year, those stores are out of business. They didn't go about it the right way. There's a right way and a wrong way of doing things. And unfortunately, when food desert mitigation is done the wrong way, a lot of people suffer, especially children. So there are all kinds of resources available for people who want to do this the right way. So I'm going to move on to the second presentation, which again gets more into active outreach and how Tennessee State University and myself have been involved with actively engaging in food desert mitigation from an educational standpoint. In the second presentation, there'll be a little bit of overlap, but not a whole lot. I'm not going to play this video, but you can. This is a live taping a few years ago when I was on Channel 17 and I was interviewed about food deserts in Nashville. I've also included maybe one or two other news clips of interviews or my being interviewed by local news about food deserts, because as I said, I was the first person to map Nashville's food deserts, part of my claim to fame. And so, that's I'm often called upon. So this part of the project extends a little bit past 2013 into 2017. And so again, here is just an example of a closed down grocery store. And this map is the map of my original 4 Nashville food deserts. And again, that original map from my cartography class. And so some of these, again, you've already seen from the last presentation. But here's where we start to get to the root of the matter. A few years ago, I got a $15,000 State Farm Good Neighbor Service Learning Grant, which was added to that another $10,000 from the U.S. Department of Housing and Urban Development. And I got $2,000 from the GLOBE program and another $3,800 from the Map Your World grant program. Some money from Title III. That money was used to build a GIS and research program at Pearl Cone High School, largely for at their 9th grade academy. Again, at that time, Pearl Cone's enrollment was 93% African American, and I know that school now is 100% free lunch, free and reduced lunch, or I think it's 100% free lunch. Relatively low income population. So students in my geospatial issues and environmental security course were given the task of developing a food desert lesson for students at these 9th graders at Pearl Cone. The first one was designed to give these students a look at their global food footprint. So we asked them to bring food from home, and we looked at where all these foods that these children were consuming at home came from. What's the source of these foods? And then we created this map of the food sources. And as you can see, these students were pretty shocked to learn that their food comes from all over the world, all over the United States. And so we started to ask them to think about that, or maybe you should think about how much energy is consumed bringing all these foods from all over the country by truck or by plane or what have you to Nashville. We're very fortunate, or maybe even spoiled in this country. We get a lot of food here, from all over the place. Not everybody can do that. We can eat food, whether it's in season or not, all year long. Citrus fruits. Citrus fruits are winter fruits. You're not supposed to have grapes, you're not supposed to have oranges and lemons and limes in the summertime, but we do. We just get them shipped here from all over the world. And so this is our food footprint. And you can see our footprint is very large in this country. And so that's why there's a movement towards locally grown food, urban gardens. Let's get out of this practice of burning up fuel to bring all these foods from all over the country and all over the world. Now here's a map that we created when we queried the students and asked them a few questions. Which grocery store does your family go to the most? How many days of eating fast food? How many days per week does your family eat fast food? And how many grocery shopping days do you go on per month? And how far, and we looked at how far those grocery stores were from their homes. We had some very interesting results. Also, how do you get to the store? Every single student at this relatively low income school got to the grocery store in a private automobile. And this is, as you can see, this is 2014. This is before it was no Uber, no Lyft. And so, people are going to get to the store if they have to get a ride. Everybody, even if they don't have a car, they know somebody who does have a car. And they can ask for a ride. Can you take me to the store? Ask your cousin, your son, your brother, somebody who has a car can take you to the grocery store. And what's interesting is the grocery store choice. For North Nashville, the area around where Tennessee State University is located, the most popular grocery store was this Walmart Supercenter way out Charlotte Pike, not the Kroger that's right in the neighborhood, which says something, which is interesting. A lot of people in these lower income communities prefer Walmart because Walmart has the cheapest prices, period. So the distance is offset by the cheap prices in Walmart, right? And so we've seen people travel substantial distances from these food deserts to get food. And the base layer, the base map here is based on the amount of money people spend on food outside of their homes. So the presumption is if you're spending money on food outside of your home, you're eating probably fast food, right? Or you're not cooking healthy food at home. And as you can see, there's definitely a coincidence between these households that have frequent days of eating fast food and those red area symbols. Not 100, not a 1-to-1. It's not a perfect correlation, but it's a strong correlation just by casual observation. What we did expect was that families that were farthest away from their preferred grocery store, that they would eat fast food more often. And so this was kind of an experiment. I'm going to go through these. This was an experiment in scientific inquiry and looking at variables that we did somewhat on the fly in this class. And so we made this rough graph. So here on the independent axis are the students themselves, the miles they are from the grocery store on average, and then shopping days per month. So for example, we expected for farther distance to have an inverse relationship with shopping days per month. As you can see, there was no strong correlation there. There was no strong correlation between um, the consumption of fast food and distance. As you can see, it varied somewhat. But at least the students were able to make some form of hypotheses, and then we did a scattergram of the data, and so we tried to see if there was definitely either some form of linear, uh, either positive or inverse relationship amongst any of our variables. Now we did this on the fly. It's not perfect, but you can look at this graph and see that there were some correlations to some degree amongst some of these variables. So this brings us up further to the REACH 2020 project. So I was a geographic information systems consultant for 3 years on this close to $500,000 project that was funded by the Centers for Disease Control at Meharry. And the REACH 2020 project was essentially a food desert mitigation project. The primary approach was to establish urban market sites primarily at faith-based institutions in food deserts in Nashville. So the REACH 2020 people used my original food desert maps to locate places, and then they found cooperating churches that would serve as urban market sites. So on Wednesdays and Sundays, they would set up urban markets at these churches for their parishioners and anybody else who wanted to come by. It didn't quite work out very well. And that is because, again, food retail is a very, very narrow profit margin business. And so the way that this program worked was that the Meharry Medical College subsidized food deserts to participate in this program. And even with the $10,000 and $15,000 subsidies, some of these vendors still lost money. And as soon as they lost money, they were out. They would quit. They didn't have, if they lost money 1 week, they were out of there. And so again, asking these vendors to participate in this program would oftentimes stretch them in terms of having to hire more employees. There goes your labor overhead costs going up. They also had to purchase more product. If for whatever reason, this could be something as simple as a rain. It could rain on the day that they were supposed to have the urban market at a church, and they would get no money. We would not see that vendor back the next week because they just can't afford the risk. And so if nothing else, we learned that this type of bringing food to food deserts is very difficult to sustain in terms of sustainability. My urban geography class in the spring of 2017, their class project was to identify vacant property in North Nashville, specifically the Buena Vista community, that could be potentially converted to urban gardens. And the results show that there's certainly enough property in North Nashville that could be converted into urban gardens if necessary, or there were enough abandoned buildings that could be converted into indoor greenhouses and perhaps hydroponic facilities so that we could grow food year round. But some form of outreach would be necessary. We'd have to get people to maintain the gardens, which is a challenge. Research shows that when urban gardens first start up, there's a lot of enthusiasm. Everybody's out there. Everybody wants to be involved. And over a period of time, enthusiasm wanes, and so it takes a real collective effort to keep these urban gardens going. Also, a lot of urban gardens in Nashville, well, most of them, or pretty much all of them, are not land uses that are in line with zoning. So gardening is essentially an agricultural land use. Most of the property that we see urban gardens on in urban areas is residential or commercial land use. It just happens that the land is vacant. And so ordinarily, you couldn't have an urban garden or an agricultural utilization of land on residential zone land. But a lot of cities kind of look the other way, don't enforce zoning for these properties because it's something that's good for the community. But the property owner always has the option of selling that property. And that's what happens a lot of times. A lot of times you have properties that get sold right from under urban gardens, and the urban gardens have to move. One of the cases I remember in Atlanta was the Truly Living Well urban gardens, which were huge, right beside the Sweet Auburn district in Atlanta. But after a while, the property owner sold to residential real estate developers. It was just too much money to turn down. And so that our urban garden had to shut down. And so that's another challenge, is with inner city communities that are food deserts that are gentrifying. It's a very tenuous situation. I showed you the video where there's a video, I didn't show it to you, but there's a video that's amongst your research materials about Earth Matters Tennessee, and how gentrification directly led to that urban garden being bulldozed a few years ago. That urban garden was founded there by Sizwe Herring, who is probably the #1 urban garden expert in Nashville. It had been there for 20 years in the Berry Hill section of Nashville. Neighborhood gentrified, and the new arriving residents of the neighborhood just did not like seeing what Sizwe was doing it was public land. And they complained, and eventually the state came in and literally bulldozed his urban garden. You can see, I have articles about that amongst the research materials. So any urban garden is subject to that kind of land use decision making. Here's another mitigation effort. This is Uplift Solutions. Uplift Solutions is a social entrepreneurship company based in Philadelphia, Pennsylvania. What is social entrepreneurship? Social entrepreneurship is, they sort of act like a nonprofit. So a nonprofit organization is just that. It's a nonprofit 501c3 tax code organization where at the end of the year, their balance sheets have to be zero. They can't make a profit. Therefore, it's a nonprofit organization. People who can get paid. The United Way is a nonprofit organization. The Red Cross is a nonprofit organization. But they do have executives who make millions of dollars. They're just nonprofit organizations that have a whole lot of money. But there are other organizations that are what are called social entrepreneurial organizations that are for profit, but they try to do good, make money and do good at the same time. And so Uplift Solutions, they develop supermarkets and grocery stores in food deserts. That's what they do through an educational process. They use a lot of GIS in order to investigate the market potential, and try to put a positive spin on food desert community demographics versus a negative spin. Oftentimes, mainstream retailers look at a low income or moderate income community and say, there's no way we're putting a store there. It's not going to be profitable. But hey, everybody has to eat. Rich people, poor people, middle class people, everybody has to eat. So to say that is just not true. But we have to design a retail model that fits that kind of community so that business can be profitable. it takes a lot of work, and Uplift Solutions and other organizations do the kind of lead work for cities, so that instead of having an empty shopping center, instead of having a community with health problems directly related to lack of access to food, a city can invest and bring Uplift Solutions in, doing the work on the front end that will result in long-term success on the back end for a grocery store in the food desert. We meaning a group that I was working with in Nashville, was very close. I mean, we literally had a contract for Uplift Solutions to come to Nashville and try to establish a grocery store in the Edge Hill community, but there were some things that happened that resulted in that not moving forward, unfortunately. Okay, so again, thank you for watching this video. You have your assignment. The reflection paper is due on Wednesday, the 20th, and hopefully we will have a robust conversation about urban food deserts and urban food insecurity and mitigation of those issues, and so on and so forth. So let me just go one more time to my screen share here, just to remind you. Here's the assignment. Assignment 1, assignment module 11, assignment 1, and so here we have the assignment. Again, if you have any questions, please let me know. And looking forward to reading your reflection papers. Again, be sure to read through the various supporting materials. There are lots of them that should help you write a very strong essay along with this recording. Hope you're enjoying your weekend. And as always, think, work, serve.